Thank you, Controller. Acknowledge the many commitments in the programme for government on enhancing and implementing greater access to primary care and primary care services across the country. At the centre of any primary care system is having enough GPs, both in urban areas and in rural areas. I think we all agree the life of a GP is not an easy one. It's long hours in surgery and in community, listening to, meeting and treating people of all ages at all times of the week. The HSE Planning Office estimates that with the introduction of the under-6 GP visit card, demand for GP consultations in this population will have increased by 65% in 2017 and by a further 42% by the time we get to 2022. This is also having an impact on patients' access to GPs. In some urban areas, there are 2 to 3 day waiting lists to get to see a GP, but the irony is that in many rural areas it is becoming more and more difficult to fill vacancies where a GP retires or moves to another location. The life of a rural GP has extra challenges because they are on call 24/7, living in the community that they serve. FEMPI cuts had a considerable impact on general practice and on general practitioners. Allowances were cut by up to 38%. It's had a significant ongoing impact on GP morale, on retaining people to work in general practice in this country, and that is now resulting, as I said, in GP shortages. According to the ICGP, there will be shortages in order of 1,000 GPs in the next 10 years, and a total of 36% of our current cohort of general practitioners are over the age of 55. The IMO, who we all met here last week, are saying that there are 666 GPs over the age of 60 who will be retiring over the next 5 to 7 years, of which 244 of those will be retiring over the next 2 years. Those statistics are real people, they're real lives, people making choices about their own lives. They also represent communities and a very vital community service that now may be withdrawn or restricted. And that is being met, Taoiseach, by a head stuck in the sand on the part of the Minister for Health and the Government in relation to the impending crisis in primary care. Where are we at, and why is the Government continuing to delay discussions on FEMPI reversal for GPs when there has been progress across all other cohorts? Why are the Government not responding to the crisis within GP morale and within GP recruitment? And will you confirm that the concerns of GPs over FEMPI cuts will be addressed and that there is a pathway for them to actually see a future, not just for themselves, but for serving their communities?
Thank you, Deputy Calleary.
Thank you, Thank you, Taoiseach. You speak about ongoing dialogue, but there is no dialogue. The discussions around FEMPI have been long-fingered and long-fingered. The NAGP, who represent many GPs, aren't even involved in those discussions. There is research and surveys available to show that maybe 70% of GPs are no longer in a position to take new patients because of the pressure on their practice, and yet you speak about wanting affordable GP access. You cannot have affordable GP access when you don't have enough GPs. You cannot have affordable GP access when GPs are saying we do not have the resources to take on any more patients. We're only spending 3.5% of our health budget on general practice. That's a contrast to over 8% in the NHS. And in Australia, who are actively targeting GPs from this country because of their training and because of their skills, that figure is even higher. So, Taoiseach, you're speaking about dialogue, and you're speaking to a matter for the Minister of Finance and the Minister for Health. The Minister for Health is asleep on watch on this one. He's asleep on watch when you see 7 out of 10 GPs saying they can take no more patients,